Good morning, everybody. Last time we have discussed the physiology of ascending tract. Now we'll continue with the discussion and we'll see what will happen if there is lesion to either of the tract and how the patient presents with a symptom. Let's just rewind. This is our one of the tract which is arising from the skin and directly going up to the medulla oblongata without crossing and without any synapse at the level of spinal cord. So this is the straightly first order neuron. This is opposite side, again arising from the skin, going straight up to the medulla oblongata without crossing and without making any synapse at the level of spinal cord. Now from here, but from the medulla, these two nuclei, if you just remind, these are the nucleus gracilis and nucleus cuneatus. Nucleus gracilis collecting information from the lower part of body, and nucleus cuneatus collecting sensations from the upper part of the body. Now from here the fibers arising, crossing to opposite side and going to the thalamus. Okay, means information from the right side is going to the left side, but level of crossing is above the medulla. Similarly, the opposite side. Okay, and from thalamus it is going to the sensory cortex through the fibers. Now this tract is called as dorsal column tract, also called as posterior column tract. Now this other tract which is arising from the skin, this is the sensory nerve and collecting information and ending in the spinal cord. Now from here we know sensory relay neuron starts, cross to opposite side and going straight to the thalamus. Okay. Similarly, opposite side arising, and you can see there is a synapse at the level of spinal cord. So this is the first order neuron. This is the second order neuron. From thalamus it is going again to sensory cortex. Now this tract is called as spinothalamic tract. So spinothalamic tract is a cross tract at the level of spinal cord. Dorsal column tract is uncrossed at the spinal cord. Crossing takes place beyond medulla oblongata. Okay. Sensations we know. This dorsal column tract is carrying the sensation of touch, and spinothalamic tract is carrying the sensation of pain and temperature. Now we'll see what will happen if there is lesion of one side of spinal cord. Okay, now we have taken a section now. Okay, so we have taken, suppose this is the T10 segment of spinal cord, only one side, that is, suppose that is this is the right side of spinal cord is damaged. Now simply straightly you can see in this now what is going to happen. See, this tract is being damaged, but you can see this tract is intact. Okay, and this tract is damaged. So what can happen? Simple, you can see touch sensations on the same side below the level of lesions are affected, and these are the fine touch which are being carried by the dorsal column. Same side pain and temperature are intact. Simply you can see it is being carried, crossing to opposite side, going here. Okay, and pain sensation on opposite side, pain sensations carried by this tract is damaged. Okay, so this is called as dissociate anesthesia. Touch sensation on same side, pain temperature on opposite side. Okay, so this is the classical features. Now through this examination of touch, pain, temperature on both sides, right from the cervical region to the lumbar region, if you examine, you will be able to locate exactly which part of spinal cord is affected. These are the different nerves. That is the importance of knowing the anatomy of the nerves right from the top to the bottom. If you examine the nerve, examine the sensations properly, and if you know which sensations are carried by which nerve, you can easily localize which part of spinal cord is affected. Okay. Now here comes the importance of knowing the dermatomes. Dermatomes means this is the part of skin supplied by one segment of spinal cord. Here you can see in this Guyton classical diagram, it is everywhere it is mentioned. C2, C3, C4. These are the areas innervated by the respective nerves. And remember, it's duplicate on either side. So if you examine the sensation, these are the regions. Suppose this area is damaged. That means L2 segment is affected. If both side, right side, left side, you can examine. So by knowing this physiology of dermatomes, we can exactly localize which part of spinal cord is affected. Is it clear? So that is the importance of knowing the our tracts, ascending tracts, the level of crossing and sensation they are carrying. And we should have the knowledge of root values of each and every nerve and areas being innervated about them, so that through the dermatome knowledge we can exactly localize which part of spinal cord is affected. Okay. I will move forward now. We have now the knowledge of ascending tracts, but what exactly it is, even if I am stimulation here, whether it is stimulation by touch, pain, temperature, everywhere if you remember, it is generation of receptor potential which will stimulate the nerve, and here stimulation means nothing but generation of action potential. Whether this is the spinothalamic tract, dorsal column tract, everywhere action potential is driving up to the brain. Now the question should arise in the mind, how the brain differentiates whether this action potential coming is of pain, if of touch and temperature. That is the first question, means what is the sensation. Second, from which part of body it is arising. Third, and how much is the intensity. So everywhere actually action potential is coming. It's nothing but action potential. So action potential is the language of CNS, but the brain needs to interpret this action potential in terms of whether it is a touch, pain or temperature. Second, from which part of body is coming, that is localization. Third, how much is the intensity. Now this is called as basically coding of sensory information.